Thank you very much to Luchika for setting such a high bar of expectation as we head into the first panel today. I'm not sure how many of you were over at the interactive hearings over in New York. I was there for the hearing on NCDs, but which I think came right after TB the day before. And there was such a groundswell of expectation, but also optimism, but also an idea of the scale of work that still needs to be achieved before September comes round. It's obviously the first time that TB has a UN HLM, and this is why it's essential for everyone here to be the champions, to keep pushing over the next couple of weeks. And one of the questions I want to ask this panel, especially of those who have been critical to the in-country and regional advocacy, is now that the declaration, that part is closed, how do you make use of these precious weeks coming up to September? Is there anything more that one can do ahead of that? There is a journey that Luchika and I were discussing earlier, which makes sense. And the most recent part of that journey obviously kicked off in Moscow in November for all of us who were there. It continued in March in Delhi with the NTB summit, and it continues now in Amsterdam. We'll roll on to New York in September. And if we think more widely and take TB out of isolation, of course, there's the UHC HLM, and I think the dates for that have just been announced for September 2019 as well. So as we sit here today, the negotiations on that political declaration have been closed, and everyone expects that the declaration goes into the so-called silence to be approved by the UN missions over in New York. There was a very successful, I heard, civil society meeting organized in early June in New York with a large number of people living with TB, researchers and parliamentarians also present. And in the main, what it calls from that declaration are to find and treat and cure 40 million people with TB by the end of 2022. And this represents basically the findings of all people with TB, and to put them on treatment, including 3 million children and 1.5 million people more on top of that. Also to provide preventive treatment to at least 30 million people infected with TB, to close the gap in funding for implementation, and up to a total need each year of $13 billion in research, where per year the funding need is $2 billion, to transform the TB response to people-centered, gender and human rights base, to develop new diagnoses, new vaccine and new and shorter regimens to treat TB by 2025. And of course, we need to think about how do you safeguard all of this for those who will have access to it. And just one more point, to develop and implement a multi-sectoral accountability framework. And in that one sentence alone, we're going to unpack that in different sessions today for all of you. So this is why this panel, which in a sense sets the scene for what's going to follow over the next couple of hours, speaks about some of the most important aspects of the asks of this declaration, looking forward to that HLM, but most importantly, beyond it. What happens after the 27th of September? Is it the end of business, or do we go and propel ourselves forward from there? That's not the question I'm going to answer, but it's a question that the four panelists that Luchika already described are going to answer much more fully. An incredible panel. Bill Steiger, who is the Chief of Staff of USAID, Eric Goosby, the UN Special Envoy. We've got Yuliya Chorna from civil society, and of course we have the Minister of Health from Pakistan. But Bill, can we start off with you first? And one of the questions I think that we need to answer over here is what this HLM can do to help everyone reach the SDGs on TB. So if we take a slightly longer look at that, or perhaps we can also look at another question, is what can this HLM do to accelerate the TB response? How can it help people living with TB?
Great. Thanks so much. And good morning. Appreciate it. It's an honor to be here on this panel, and I'm grateful to Luchika for inviting me and allowing us from USAID to participate, and grateful for all of you who've come this morning. We see the high-level panel as an extraordinary moment in time that offers a great opportunity for this community to raise its profile and to raise TB on the global political agenda. A number of us here, including several of us on the stage, were involved in the high-level meeting of the General Assembly on HIV/AIDS now 17 years ago. And those of you who were there remember the electricity of that moment as well, and how it galvanized the response around the globe to HIV, and concretely led to, in part, the creation of the Global Fund, and helped to inspire the extraordinary commitment that the President's Emergency Plan for AIDS relief in the United States has been. So we think this represents the same kind of moment for tuberculosis around the world. Concretely, I think it can help drive the message of the challenge that TB represents to all of us around the globe in at least three ways, to ordinary citizens and to political leaders around the world. We know about the public health challenge. You've heard about that eloquently already this morning. We in the US also are very concerned about the two other dimensions, at least, of TB that represent threats to the globe. The health security challenge, because of the drug resistance that multi-drug resistance tuberculosis around the world represents. 25% of antimicrobial resistance is due to tuberculosis cases. And then the economic challenge, that if we don't get a handle on this problem, that it's more than $300 billion of lost productivity around the world by 2050. So those kinds of messages that go beyond the health community are the kinds of things that the spotlight that the high-level panel, high-level meeting represents, can shine on this problem around the world. We hope, in addition, so we're doing a couple of things, James, to answer your question concretely, to make sure that the 27th of September is not an end point, but very much a starting point. One is we're working diplomatically to get as many of the highest level political leaders around the world in the room in New York in September, including from our own government. We think that that kind of presence and commitment really does help to drive change afterwards. And the high-level meeting on AIDS now almost 2 decades ago, I think, is proof of that. But we also want to make sure that the community gets heard in September, and that the voices of those affected by tuberculosis and those who are working with tuberculosis patients and their families also can be a key part of that day and beyond. We hope that there are, in addition to political will, expressions of political will, that there are expressions of financial commitment that come out of this in New York, and that there are also expressions of willingness to change the way we do business. I think one of the things you're going to get to in a little while is that there are things that we can all do, including us in the US government and our own programs, to make it easier on patients and their families, to make it easier to find them and to support them. And we hope that comes out very strongly out of New York as well.
Bill, can I ask you something? Because I think it will link very well to Yuliya right after you. You talked about one of your concerns being economic loss. And we hear about this in all aspects of health. When you don't have healthy populations, you're going to suffer from a loss of productivity at the peak of productive age as well. For the champions, because I think that goes for everyone who's here in this room, what would you tell them about amplifying the work that you and your colleagues widely, not just at USAID, do? How can they translate that message best in their communities to their political leaders, to their constituents, that if you don't get a grip, as you said, on this, you are going to lose out?
Absolutely. A couple of things. One is running the raw numbers, and we have them. Many of us, I think all of us in this room know them, but not many people around the world understand how expensive it is when a government comes across a case of multi-drug resistance tuberculosis, for example. We in the United States estimate in our system it costs well over $1 million just for one case. Often that's something that's the burden at the state level, not the federal level. So that multiplied across the globe in real concrete terms means an effect on budgets for ministries of finance. And there is a concrete economic argument to be made to ministers about why prevention is far better than treatment in the case of drug-resistant tuberculosis. There's also the aspect, I think, of how important this disease is as a barrier to women's empowerment. I have learned much more about that in my time back in government here in the last year than I did before. And the economic effects of the stigma and discrimination that many women face who have tuberculosis and their families face when a woman comes down with tuberculosis. The isolation, the loss of livelihood, the discrimination that women face in many countries around the world with TB is an extraordinary drag on productivity at the household level and at the government level. And that the opportunity that the high-level panel represents for us to be able to translate those economic losses in in real terms, in patient terms, in families' terms, in the terms of communities, to the world community when the TB takes the stage in September is one we should not miss.
Thanks very much, Bill. Yuliya, Chorna, if I can introduce you to everybody here who may not know you already. You're the TB Advocacy Manager at ICF Alliance for Public Health, based out of Ukraine, but you're also the Vice Chair on the board for TB Europe Coalition. What you really lend to this conversation is your in-person experience of in-country advocacy, regional advocacy, coming up to September. As we said over there, the negotiations have ceased in that sense. But I did specifically want to ask you, there are precious weeks ahead till the third week of September. What can everyone still do? Is there anything that one can still do to help shape minds and hearts?
Good morning, everyone. It's been a pleasure and honor for me to be a part of the panel and to have a chance to reflect on windows of opportunity for the affected communities and civil society to support a successful UN high-level meeting on TB. And if you think about three NTB strategy pillars, integrated patient-centered care and prevention, bold policies, and intensified research and innovation, we will acknowledge that civil society play a critical role in advancing of all of them. And we are at front of working with most vulnerable people, key affected populations, unreached by official systems. And it is basically affected communities who support people undergoing TB treatment on their daily routine and who encourage them not to give up and to stay adherent and to be recovered. So therefore, it's naturally that the civil society and affected communities are also at the core of UNHLM preparation processes at different levels. So we are mobilized and we are setting forward to drive the agenda, and we already did some very important things which I want to reflect on, as well as answer your question about the next steps. So globally, there is an affected community and civil society advisory panel, which is one of the official work track for preparations for UNHLM. It is supported by international civil society support, and it brings members from all over the globe to really participate in all core processes. Regionally and in countries, there is a linkage with this global panel. So for now, we contributed extensively to the development of the 5 global asks, which informed the negotiations about political declaration, and I believe it also was reflected in its content. As well as for in-country advocacy, many of our constituencies, including ourselves in Ukraine, did do a lot of work reaching out to high-level decision-makers, including members of parliament and high-level officials. And for this extent, it's very important to work with the existing platforms, both civil society platforms and, for example, such platforms as Global TB Caucus or national caucuses in the countries. Then you can amplify and make your voices heard, and you could influence both the agenda for country delegations to attending UNHLM, as well as use this unique opportunity to really find consensus about many burning issues for the countries, because otherwise you wouldn't have the access to these people, right? And under this umbrella of UNHLM, you have all this platform to coordinate, to mobilize, to work together, and to find the common solution. So, so far, we have been advocating through countries to the heads of states and heads of governments to attend the UN high-level meeting. We have been sending numerous letters, making briefings, meetings with different platforms, including country coordinating mechanisms, decisions, and also we are now, for example, in Ukraine, working very closely to ensure that the civil society representatives will become a part of official national delegations. And I think that the situation is quite the same in other countries as well. So all these processes are set and on the run. But now, with the major processes on draft political declarations are over and preparation activities in the country are on run, what can we do still? I think it is very important for us to focus on post-HLM accountability processes. It's really about ensuring that the commitments of the highest political level actors and the targets which are agreed for political declarations and for country delegations are implemented, and the status quo to challenge TB and to NTB is changed. In this regard, multi-stakeholder framework on accountability developed by World Health Organization is an important step, but we as a civil society and community have a moral obligation to advance it further and to ensure comprehensive and practical application of accountability at all levels. Therefore, we call for the high-level independent body which should have the high expertise, but also the political freedom to voice up and to speak up honestly about the country experience, sees both positive and negatives and the existing gaps in achieving the set targets. And this political, independent political body is critical actually for accountability processes. And of course, to be really comprehensive and to reflect on all the voices of civil society and affected communities, civil society should be a part of the processes for setting this independent body from the very beginning, and then also to have the representation in this independent body while it will be working. So annual and in several years meetings of the body to reflect on what's been achieved, it's really important. And this is really a way forward for country and regional advocacy by civil society to ensure that these accountability mechanisms are working. Thank you.
I've got another question for you. It sounds like you're doing the really hard graft work and you're doing it in the right methodical, meticulous way. Just a direct question to you, and it's not a leading one. Do you feel that you're being respected in this process? Because we've heard already from a number of people, including the DDGs, saying how important, of course we know how important civil society is, but do you think that those efforts are being absorbed by the political leadership, for example? Do you feel that you're being counted in the way that you have the right to be?
Thank you very much for this question. I would say that answering it, it's very important to understand whom you are cooperating with. And if as a civil society you have a good proponents and collaborate with with other platforms, then it's really a way for you to be heard more and to have a more decisive voice. As I said, for example, in our country, we work closely with the parliamentary platform, and we work closely with Stop TB Ukraine platform, which is an umbrella organization bringing more than other 40 organizations on board. And then when you join all these other stakeholders, of course, you are, heard. It's more like rather than you will be working alone and to make it, more clear and hearing. So my answer is the way of cooperation and joining efforts with other people who might make influence really makes a difference.
Thank you. Thank you very much, Yuliya. May we just go traveling down to that side next to Yuliya to Professor Mohammad Youssuf Sheikh, who is the Caretaker Minister of Education, Climate and National Health Services Regulation and Coordination of Pakistan. He is the pioneer of scaling up modern education in that country. And in this period of the interim government, he's taking charge of the important health portfolio. The Minister and I had a very brief exchange before coming up onto the stage, and he was describing the significant cuts in deaths for TB for people in Pakistan, but of course also the big step up in access to treatment. Of course, those two things are not separate from each other. So I was wondering, Minister, perhaps you could quickly color for us about some of the things that perhaps you're worried about or some of the things that are working for you, and perhaps you could then expound on the pillars that are shaping your response and what you think you want people here to walk away with from that.
Thank you very much. I feel honored to be here in this international forum, as you are informed that we are passing through this formative phase, transition phase, and my presence here only shows the strong resolve of the government of Pakistan to be combating this TB and showing solidarity with the international community as to how to go ahead. And particularly in view of the UN high-level meeting that is going to be there in September this year, we are really very serious about it, and I have come here to express that resolve. Now, in this regard, my approach or my submissions would be on the multi-sectoral approach in combating the TB, as to whether it is a solo flight of the government or we are having collaboration with the civil society and the other stakeholders, particularly the affected community and those who are working in the field in any capacity. So that way, it has been a very great success, and we have our national plan also that is going to, it has already been chalked out in 1970, and by next couple of years, we would be, inshallah, achieving, God willing, we'll be achieving those targets. And that actually is, and now, just after this meeting that is here, we are going to chalk out those practical strategies in August 2018 so as to be in a position to give some solid and tangible and concrete proposals and suggestions at the UN HLM high-level meeting. In the meantime, as I have been specifically asked as to what pillars and principles that we are following, now, we have mainly three pillars to fight against this menace. And they are, one is the integrated patient-centered TB care and prevention. That is the first pillar of our strategy and the plan. And second is bold policies and supportive systems. And third is intensified research and innovation. Now, these are the main three pillars on which we base our strategies. And the principles that we are following is that the government's stewardship, government's active participation, government's practical patronage to all the activities and whosoever is in this, because in government also we are taking along not only Ministry of Health, but Ministry of Planning, Ministry of Finance, and even Ministry of Education, because it is very much related with education to the extent that we would love to, and we have started working on it, that it should be the awareness about TB and the measures to be taken in this behalf are supposed to be the part of the curriculum right from beginning, so that the people at the very early stage and early age, they also become aware of its hazards and the future outcomes. So that way, we are following that principle of multi-sectoral, and so government's stewardship and accountability with monitoring and evaluation is also the principle that we are following. And then building a strong coalition with the civil society and the communities, affected communities, as well as the communities working in the area, working on these in this field. And third is promoting and protecting and promoting human rights, ethics, because that stigma that it carries, we have to educate our people, and we are on it, and we are following it as a very basic principle of our strategies. And fourthly, the adaptation of the strategy. Adaptation with all that development that is taking place in the field of this TB control at national, international, regional level, we have to adapt our policies like that so as to make them purposeful and result-oriented. That is what precisely we are following. So if you have anything, but as I said that I have come at the highest level being Minister for Health, though I have a couple of other portfolios as well. And after a couple of days, we are going for general elections. Today it is 22nd, and on 25, we are having our polls. And my presence here speaks of that. I could spare from them, come here and then show my solidarity, my government solidarity, my country's seriousness in this respect, so that we really are making productive and result-oriented efforts. And we are all country, Pakistan is with you in your all efforts that you are taking at any level, regional level or international and global level.
Thank you very much to the Minister for being with us and to demonstrating that support very clearly. I'd like to bring you now to our final speaker, Dr. Eric Goosby, who is well known to everybody in the family that we are all part of. And in his different roles as a clinician, as a researcher, as a policymaker, but I think I've always associated you with embracing all the important aspects of the fight against AIDS and also TB, of course, the special envoy for the Secretary General, but also your life as I see it. You were an intern when AIDS first emerged in your city in San Francisco, and also, of course, in New York in June '81. But you've embraced so much, not only of the science, but also of the love and the care that is so necessary to this. And the Minister just mentioned the human rights angle, which is so important as well. Dr. Goosby, you know, TB, if we take the long view of it, has been around for centuries. We've learned as humankind to somehow adjust ourselves to its cruel realities. And we're going to hear very much today during the different break-ups and breakdowns of those sessions about the biomedical response that's necessary to put a stop to TB once and for all. I've got other questions for you, but can I just take a moment first to focus on why that multi-sectoral approach that we assume matters? Why does it really, really matter? And also, can you help us understand why the multi-sectoral approaches matter in countries that can organize this type of collaboration?
Well, thank you, James. And thank you to this really distinguished panel. It's an honor to be with you up here. And to the organizers for the meeting. I think the integration of HIV and TB thinking is best facilitated in meetings such as this. And to echo Luchika's request that we be in the integrated program of the international AIDS meetings is something that I think we'll all focus and work on in the upcoming year. I think that tuberculosis does present a challenge to medical delivery systems in that you have a population who's infected and affected from TB who are not easily identified, entered, and retained in care. You have to be concerned about different populations and their specific access points, not at one point in time or for when you start a program, but each and every day that program operates. There needs to be an ability to look back at your effectiveness in identification, entry, and retention. Tuberculosis, unfortunately, has always impacted those who are lower down in the economic wealth of a country and a community. And when the economics drop, housing and nutrition conditions drop as well. Those favor the spread in an individual with a drop in their nutrition and their immune function, their ability to contain infection, and the movement of the mycobacterium through the community is impacted by where individuals who are infected are in the community, how close they are to others, what's the recurrence of that. And I think that as you become less and less able to control your environment with resources, those high-risk settings increase. The medical delivery system that takes the responsibility to respond to that needs to take that into account. And because of the bureaucracies that move our resources to create responses, go through many different agencies, in a government, it becomes critical that that government understand that that kind of filigree of movement through multiple bureaucracies to put program on ground is a delay in its responsiveness and ability to put its services and resources in front of the population that most needs it, and to benefit from the science. And I think tuberculosis highlights that better than most diseases. Even though every disease has those elements, TB has them in spades. And I think that the delivery system needs to consciously reposition and challenge itself to maintain that repositioning with the population over time.
Another question? We talked about the journey so far in the last year. We saw you over in Moscow, for example, and we've talked about Delhi, and you know, this New York thing, as Bill said, shouldn't be seen as the full stop. It should be seen as maybe as a comma, where we reset and just propel ourselves forward. And you can get very consumed by these political declarations, but as a special envoy, and just as you, is there any evidence, any real-time evidence that we can draw optimism from all of those meetings, that they can actually lead on to life-saving interventions, and not just be another declaration that's a nice document that's just going to stay there for everybody to sign off on the 27th and walk away from after that?
Well, I think, James, that is the challenge. And I think we've heard it from all of the panelists. This is the beginning of something, but the something needs to be explicitly defined and then implemented by many of the people in this room and embraced by many governments who heretofore have not fully embraced the needs of their population in regards to tuberculosis. I think that the high-level meeting brings a spotlight on a very old problem, as you've said. But in bringing that spotlight to the problem, I think we rejuvenate our ability to position tuberculosis in the appropriate, in an appropriate, urgent manner, more urgent than it's been in the past. And I believe because of the multi-sectoral nature of the response, requires a high-level political engagement so that purse string around the bureaucracies that move the resources to develop the program are disciplined and accountable to somebody in country. The president, the prime minister, the chief political officer is the best person to be in that position, and we need to understand those relationships. But as everybody has said this morning, that goes all the way down through the medical delivery system to the community itself. If the community is not energized and empowered to understand that this science needs to be delivered to the population, focused on, and that ability to do that is a combination of many efforts that converge. The community is the feedback loop to the powers that be that says it has been successful or not, that there are problems with it that need correction, and then should be allowed to engage not just in planning, this is the community, but also in implementation of that corrective act. So you get a self-correcting system over time and not just a one snapshot engagement at the initiation of a program.
So I'm going to finish off with that, the community, because as much as a clinician, you're a clinician activist. When we bring ourselves back to the earlier days of the AIDS response, the community reacted by taking to the streets and methodically demanding action from absent political leadership at the time. With that viewpoint of history that has already passed, but applying what we've learned from AIDS as well to the future of TB, or hopefully to the non-existent future of TB, what would you say to community here about absolutely squeezing out the most that they can from the once-in-a-lifetime opportunity that we heard expressed at the beginning of this morning? What is it? I mean, like a to-do.
I think that understanding the importance that community plays and the importance that having community positions be part of the planning and the implementation of every program is the bottom line. I'd say that the ability to participate as an equal partner in that, it doesn't come naturally to governments to allow that to happen. In fact, I've never seen a government embrace that on the front end, but I've never seen a government not embrace it after 2 to 5 years. They see the high utility in having those who need and depend on the services part of that planning and implementing effort. I think the second thing that I would say about community that is critical is that it not be a volunteer expectation. The community's role in this effort of planning and implementing should be recognized and supported with resources so it can continue. One of the big mistakes in the AIDS effort was not seeing that for a decade or more. And it wasn't until 1991 in the United States, a decade after the beginning of the epidemic, that a funding line, the first funding line, was generated to support community-based efforts and pushed HIV from an inpatient-dominated response to an outpatient response. And in the United States, that was the Ryan White Care Act. So not having it a volunteer-based resource, but to have it funded.
I said this at the NCD's interactive hearing, that civil society, please be less civil. Don't be so polite, because you are not going to get anything unless you ask and you demand and that you push. And of course, governments need to do their part, for example, in responding to that. But the more and more you push, the more of an answer you are likely to get, I think. So I think on that note, on that positive note, I'm going to hand back to Luchika, but also by thanking Bill Steiger, Yuliya Chorna, Minister Youssaf Sheikh, and of course, Eric Goosby. Luchika?
Yes, so we would like to have a few minutes if there are questions and answers from the room, questions from the rooms or remarks. We are a bit behind the time, but okay. I see two hands, so 3 hands. So okay, we will take these 3 questions or comments or reflections, and we will then go to the next session. So Ezio, you go first.
Okay. Thank you, Luchika. I'm Ezio Tavra from the Brazilian TB Researchers Network and a member of the Global TB CAB. I would like to hear from the minister from Pakistan what has been the improvement of engaging communities in Pakistan, and how are they participating in the policy-making process in Pakistan, and how are you supporting the communities in your country? And I would like to see that expressed, because and not only in Pakistan, but also in other communities, to see how communities are effectively, like Yuliya very well posed, participating in the policy-making process and in the accountability of the governments. Thank you.
Thank you very much. I think we will, while you think about it, we will take all the questions that we are done, and then we try to see if we can go over the panel. Go ahead, and please tell your name and your organization.
Okay, good morning. I'm Honorable Luthra Bode, the co-chairperson of the Global TB Caucus of Parliamentarians Against TB. I hear everybody saying civil society should hold government to account. And yet recently, in Zimbabwe, I read in the papers that the USAID was withdrawing funding from a few civil society organizations. It got me thinking that who is holding these organizations to accountable? I never understood why that statement was made. But my concern is there's an assumption that there is somebody who should be checked, and the checker, who is checking the checker? Thank you.
Thank you very much. And David?
David Bryden with Results. Thank you for the fascinating panel. And yeah, just a question also for our minister from Pakistan. We heard Dr. Kanda earlier talk about nutritional support for patients, and Dr. Steiger talked about a patient-centered approach. And so I'm wondering, in light of the urgency of nutritional support for TB patients, is that something that Pakistan might look at and consider for TB patients? I believe India has moved forward with that as well. And looking at the TB budget in Pakistan, only about 7% of the TB budget is funded out of Pakistan's own resources. So I didn't know if you might see any potential for an increase in that domestic support for TB. So two questions about your response there with the nutrition support for patients and then the financing side.
Thank you very much. So Pakistan seems to be a hit and a hot topic. Sir, so I think it shows the fact that everyone is very appreciative of you showing the commitment to travel here when we all know there are a lot of, there is a lot of work ongoing in the country in preparing
I
the
feel
election.
happy that you are taking that keen interest with the Pakistan's involvement in this. But as I told you that increasingly we are increasing the allocations, and only recently we have that Prime Minister's health insurance policy also, which is going to ensure that we allocate more funds, involve more donors, and even for that matter from civil societies, that collaboration should be more productive and more contributory. As far as the end TB is concerned, the rate of reduction in the deaths because of TB has been decreasing, and we would like to make it that it is 90% or 95% is decreased, that rate, by say 2030 and 2035, where we have rather overcome the problem. Because as far as the social development goals are concerned, well, we have fixed 2030 year, and for NTB we have 2035 as the year. So that way we are very particular and we are very specific about the allocations, about our efforts, which are going to be concerted. And to the extent that I told you, this was my submission, that the government's resolved to correlate these our efforts with the academics also. That is again a very, very bold step in the direction of our combat against TB.
Thank you very much. Bill, you want to? Yuliya, yes, please go ahead.
Thank you. I would like to maybe follow up on the second question. Actually, I cannot. So I agree with you that really accountability is a joint responsibility. Yeah, and in our call about this independent accountability body, we call for it to be able to speak openly about countries and other stakeholders' performance. So basically it asks you questions, but I would like also a little bit to follow up and to say that when we speak about accountability and target sets, we need to understand how we distribute this responsibility on performance the targets in the country. And this is about how well the civil society is integrated in the national programs. And it reflects maybe with what Eric said earlier, that civil society should be, that's why it should be on board from the planning to implementation stages, and to be recognized as an equal partner. And if we are recognized as an equal partner, if we are treated equally, then we are all accountable, for the joint performance. But we need to be a part of the process in order for our voices to be heard. Thank you.
Yeah, so we just confirmed here that Yuliya's answer covers very well, and I see that you're nodding vigorously there. And considering that we are a bit behind the time. I think it was a strong start, and I give the floor to Yogan to ensure that we close this session and panel.
Thank you very much, and thanks again to the panelists and our eloquent speakers. Please join me in thanking everyone for their contributions this morning.